let's get on to mucosal immunity. Few questions. What's the first antibody that develops in a fetus? Very good. What's the first lymphoid organ that develops? Thymus. Very good. Few other questions that show up in the next one, end of this month. FPT, failure of passive transfer. When do you say there is a failure of passive transfer? When do you confirm it? Say if you go to a farm, a 1 week old calf is coming up with bacterial infections. You try to treat them with antibiotics, but it keeps getting back. It's not an inherited immunodeficiency, so you think about failure of passive transfer. Same with the foal or a calf. So, how will we say, or let me ask the question, what's the rapid diagnostic test? Should remember that we can quantitate immunoglobulins in the blood. There are tests like single radial immunodiffusion, or you can do PCR test, or or complement fixation tests. All these tests take a lot of time, but there is one rapid diagnostic test that you can perform right where you are still in the farm. If you are going to be a large animal veterinarian, I don't think anybody that's going to be a large animal veterinarian or equine veterinarian, I still see 2, 3, even equine veterinarians are a mixed practice, but we should still be aware of the zinc sulfate turbidity test, where we put a drop of plasma or serum into a tube containing zinc sulfate. The turbidity that develops is due to precipitation of the immunoglobulins from that serum sample, and then you compare that turbidity that develops in that tube to a jar, and then decide how much immunoglobulins are present. Now, having known how much, what will be the quantity we say that confirms failure of passive transfer? Is thing to remember is when it's less than 800 milligrams per deciliter, we say partial FPT. And if it's less than 400 milligrams per deciliter, that's complete failure of passive transfer. Okay, so the rapid test again is zinc sulfate turbidity test, which is good for dairy farms. It's cheap and we can use it. There is also, I said, there is a SNAP test for foals. SNAP test, just like the combo feline leukemia 5E test that some of you might have done for cats. SNAP test or heartworm SNAP test, same thing. There is a SNAP test for FPT diagnosis in foals, a little bit expensive. So let's get on to the mucosal immunity. Again, another question always you should remember is, should not vaccinate animals when there are a lot of maternal antibodies circulating. So, if you do vaccinate around 6 weeks or 8 weeks, it's not going to be very effective. So again, if you do, then you may have to repeat it again after 3 months, or in cats and foals, maybe at 6 months again. Okay, so maternal antibodies do interfere with vaccine antigens. So remember that. Mucosal immunity, immunity at mucosal surfaces. Mucosal surfaces are extensive in the body. If you look at the surface area, they are more than what we see outside the body, the surface area. Mucosal surfaces are there in gastrointestinal tract, starting from the nasopharyngeal region, oral region, then the respiratory tract and the genitourinary tract, all are having mucosal surfaces, and they have to be protected. A lot of pathogens do enter through the oral tract, and a lot of pathogens do enter through the nasal tract, are inhaled. So how does these mucosal surfaces are protected from these pathogens as compared to, we should also think about how the mucosal immune system is not acting against innocuous, harmless antigens that are entering, either through the food, in the case of gastrointestinal tract. Food contains a lot of proteins that could be potentially antigenic and do cause problems in few animals or humans. Same thing you might ask, respiratory tract, we do inhale a lot of innocuous antigens, molds or pollen or other dust. Even dust mites, as you will see, the dust mites that are present everywhere are inhaled all the time. How does immune system doesn't act in most animals or humans against these? And in case of reproductive tract, the sperm in the female tract could be antigenic, but normally the female doesn't produce an immune response against the sperm normally. And even the fetus, a fetus in a mother's uterus is a foreign body, but usually it's protected from immune response from the mother. So these are innocuous, harmless antigens, and the mucosal surfaces are tolerized, or they don't act against those innocuous, harmless antigens. So anyway, I'm saying here, mucosal surfaces must balance their functions, their physiological functions, but then again protect those surfaces from the pathogens. Okay, you know those physiological functions. I don't have to talk about them. We studied physiology extensively, so I don't have to say. We said point of entry for non-self but potentially antigenic proteins. We said food proteins, a lot of soy proteins. Some people are allergic to like eggs. eggs or shrimp or even chicken in some people. But we said that's for the gastrointestinal tract. We said for the respiratory tract, all those other inhaled proteins might also be causing problems. But usually the system becomes tolerized. Again, we talked about reproductive system where a sperm could be antigenic. We talked about commensals, the good bacteria that's occupying spaces completely on the mucosal surfaces. You'll see a slide where mucosal surfaces are protected from pathogenic bacteria by these commensals by competitive exclusion process. And the concept of the microbiome is becoming very important. We now know that these commensal good bacteria are very essential, not only for protecting by competitive exclusion, but also from developing good immune system. Say for example, the newborn gets all those good commensal bacteria from the mother during the birth process, natural birth process. But what happens, you might think, if you deliver a puppy by C-section? It's not exposed to those good commensals of the mother if you are just doing C-section. They're now thinking about probiotics or using probiotics to colonize these newborn babies or preemies with probiotics. So again, realizing the importance of those commensal bacteria in the development of the immune system. If you use a lot of antibiotics and stop abruptly, then the next thing that might happen is yeast infections. Because you have excluded all those good bacteria, and now comes the spaces are free for yeast to occupy. He said, again, remember, the system develops that tolerance for non-pathogenic, innocuous organisms as well as antigenic proteins. 75% of all lymphocytes are present on the mucosal system.
Why tolerance?
Question?
Yes.
Mucosal system, not necessarily just on the surface, it includes all the lymphoid tissue that's involved in the mucosal immune system. Question?
Nothing, I think I get it. Like, why tolerance? Why not get rid of it?
Tolerance for commensals?
Pathogens. Oh, for the commensals. I thought it was for the pathogens. I see.
Oh, no.
Okay.
We don't get tolerance to pathogens.
Right,
That's dangerous.
No.
Tolerance for the commensals,
Okay.
good bacteria, and also innocuous, harmless antigens must be developed, otherwise we get problems. Say, for example, if there is a escape of undigested small peptides of, say, soy protein or chicken protein, some animals, humans, will develop antibodies against those and develop all kinds of food hypersensitivities. A good example we will talk about is the canine atopic dermatitis. Atopic is a kind of immediate allergic reaction that develops due to food antigens, food proteins, may involve antibodies, development like IgE antibodies triggering mast cells and all that. We'll talk about those later. But 75% of all the lymphocytes are protecting the mucosal surface, including all those Peyer's patches, dense lymphoid tissue, the bald gout, and all those things. We talked about gamma delta T cells. There are alpha beta T cells and gamma delta T cells. Why we call them gamma delta or alpha beta is the T cell receptor on these T cells have two polypeptide chains, and some of them are alpha beta and some are gamma delta type polypeptide chains. And we said it's important for you to remember the gamma delta type T cells are mostly protecting the mucosal surfaces, whereas alpha beta are mostly in the blood, in the systemic immune responses, but gamma delta are mostly protecting the mucosal surfaces. If you test, remember that if you test the blood, there are more alpha beta type cells, but then there is an exception. We said ruminants also have more gamma delta type T lymphocytes even in the blood. Okay. That's an exception for ruminants. The immunoglobulin IgA protects the mucosal surfaces. You remember that it's a secretory IgA, dimeric. It also has that secretory component, and that's the immunoglobulin that mainly involved in protection of the mucosal surfaces. Again, the exception is ruminants. Ruminants have more IgG1 type that's protecting the mucosal surface. They may have few IgA antibodies, but predominant immunoglobulin in ruminants that protecting mucosal surfaces is IgG1. Again, remember that. But if I ask in a dog or cat, what's the predominant immunoglobulin in the mucous secretions, nasal secretions, it's IgA. But if I ask in the calf, then you should say it's IgG1. Okay, IgE is also involved in mainly in anti-parasitic immunity. It's there in the respiratory tract, in the gastrointestinal tract. Say for example, if there is a nematode, a roundworm in the intestines, IgE antibody recognizes the parasite, and then it triggers the mast cells to release what? Mast cells?
Histamine?
Histamine. It triggers the mast cells to release histamine, and this histamine causes vascular or increases vascular permeability, dilates the blood vessels, increases permeability, so a lot of fluid comes into the intestine, and then it constricts the smooth muscles of the intestine. So there is an increased peristalsis, and the animal is now trying to throw out that roundworm from its intestines. A lot of fluid, and then the contraction of the smooth muscles, increased peristalsis. So that's how IgA is acting on the mucosal surfaces. Okay. Again, IgA is also involved. We will talk about that when we talk about allergies or hypersensitivities. IgE sometimes binds to allergens such as pollen, for example, in some people, and causes hay fever in the spring, right? What exactly happens? IgE binds to that pollen and then triggers the mast cells to release histamine in the lungs. So there is a constriction of the bronchioles. but there is dilation of the blood vessels, a lot of fluid accumulates that leads to difficulty in breathing, causing allergic asthma type reaction. Just nasal secretions also because of the increased vascular permeability. Okay. So that's about IgE triggers local inflammation, but that's meant, IgE is meant for acting against the parasites. IgE is not meant to cause allergies. Okay, remember that. Don't have to say much about these: gout, balls, mouth. Defensins, again, when we talked about neutrophils, we said they also produce what are known as antimicrobial peptides. These are small peptides, low molecular weight, but they are can act like antibiotics. Neutrophils do produce them. They act like antibiotics. They can take care of some bacteria, viruses, or even fungi. There are few defensins or antimicrobial peptides. Some are called alpha, some are beta and cathelicidins. Most important are the alpha defensins. These are produced by neutrophils. Okay, but the Paneth cells. Now remember your histology classes. You heard the Paneth cells, right? They are in the intestinal walls, and they produce a lot of defensins also to protect those epithelial cells of the intestinal mucosa.